Revenue Recovery Acts to lift this big burden off of Clevelanders by wiping out medical debt that many have been carrying for many years. What began as American Rescue Act plan funding ended up making a difference, a real difference in people's lives. A lot of times people see us invest in things and roads and buildings and institutions and other things, but this was an opportunity to invest directly in people. This program, like the utilities amnesty, touched everyday Clevelanders, something myself and council committed to with the American Rescue Plan Act dollars. As the program comes to a close, there is still nearly $1 million left unspent. City Council is working with each other in order to figure out where we can make that investment to the people of the city of Cleveland. And we want to make sure that the remaining funding goes towards efforts to support and strengthen Cleveland's residents. Public money should serve the public, and we're focused on making every dollar count. As I close, I will tell you that this council, through efforts that my colleague, Councilman Charles Slife, did in order to make sure that we had paid parental leave, through efforts that we've done through my colleague Rebecca Moore, working on wage theft and payroll fraud and passing laws to regulate that. Pay equity, which my colleagues Jasmine Santana, as well as several of the women on council, to make sure that women are not inadvertently discriminated against, and anybody is not inadvertently discriminated against whenever it comes to pay. Council has been working on principle-centered issues for the people of the city of Cleveland from day one, and we continue to do it. So now I'm proud to the next chapter that council can say that we're doing is through the leadership of my colleague Chris Harsh, who really was the champion behind making sure that we push medical debt and make sure that we invest in the people of the city of Cleveland. So it's my honor and privilege for another people-centered win for the city of Cleveland, and I'm going to bring up my colleague Chris Harsh to talk a little bit more about council's initiative around this. Thank you.
Thank you, CP. Well, thank you everybody for being here today. This is an exciting day for me. I do want to start off, before getting to the numbers, to thank Council President Griffin for seeing the wisdom in this program right away and encouraging me to pursue it. I want to thank all my colleagues for passing this unanimously. But I really need to thank Councilman Slife. I think I brought this to council when I was about a month on the job. And even though I knew the Schoolhouse Rock song probably wasn't how a bill becomes a law, I really didn't know what the process was. So I went to Councilman Slife and he walked me through all of it and sort of taught me how to be a councilman down here. So thank you for taking the time to show me how to do this stuff. But today is an exciting day because we are here to announce that at the end, as we draw this to a close, the collaboration with Undue Medical Debt has been able to relieve $165,234,311.18 of debt for Cleveland residents. Those are specifically Cleveland residents. We've been able to leverage even more debt forgiveness for people outside of Cleveland by partnering with Undue Medical Debt, because the debt portfolios include people and they use their funds that are philanthropically raised to remove some of that debt. So while our money stayed for Cleveland residents, we were able to leverage outside funding that helps everybody in the region. I think that's an important thing to notice as well. We did this for 161,481 Clevelanders, which is almost half the population. I think we're at 370,000, so about 40% of Clevelanders got some kind of debt relief. And we'll say that one. You guys can edit. No, we're going to let you do that one. And we were able to do this with the largest healthcare providers in the region. So this has been a tremendous success, not only for Cleveland, but for people that live in the Cleveland region. And I really want to point that out as we have conversations about the Sheriff's Department, as we have conversations about stadiums. Cleveland is the economic center of Northeast Ohio. And when we do something that helps Clevelanders, that help ripples into the suburbs, into the county, and into the region itself. So I really want to point that out. We were able to help people that don't live here by leveraging funds and using ARPA. And the last thing I want to say about this is that we originally allocated $1.9 million in ARPA funding for this. But pleasantly to our surprise, we were able to bring this program in at under half of that. I believe we have about over $1 million remaining from the initial allocation that we're going to figure out how to redirect it to more good programming. But the whole project came in for well under what we expected. So this whole $165 million debt relief comes in for under $1 million in ARPA funding. That is 0.2% of Cleveland's ARPA allocation. And so thank you for coming out here, and thank you to my colleagues for supporting this. I will hand it over to Councilman Charles Slife, who helped me walk through this process and has some more information to share about the program with you.
All right, thank you. Councilman Harsh was asking how ordinance is passed, and I remember the weekend well. I had taken my wife out of town for our anniversary and spent a good chunk of that Saturday on the phone with this guy, explaining to him why this was critical. So thank you, honey. That's how an ordinance gets passed. But we're here for it. But, really, Councilman Harsh and I kind of came to the awareness of this program and Undo right around the same time. We were reading about how this was taking place in Chicago. Some colleagues on council now in the State House in the city of Toledo were also looking into this. And kind of at the same time, by coincidence, the availability of ARPA dollars was coming from the federal government. And I think we both came to the quick conclusion, if the purpose of ARPA is to find ways in a moment of crisis to help people at the individual level, this is a very poignant way that we can do that. And much to our delight, the availability of ARPA allowed us to be able to retain a lot of money to do a lot of other things across the city of Cleveland that we probably wouldn't have been able to do but for the receipt of federal dollars, and I think that should be acknowledged. Just some other data points. The median salary for families helped by medical debt recovery was $54,000, so we're helping people who are middle income working Clevelanders, and the average amount that was wiped away was a little over $1,000. So, $1,000 is not the most money when we talk about a, $1 billion-plus budget here in this building, but if families making, middle income, having $1,000 to no longer have to worry about, no longer having to worry about how to make payments is, I think, really impactful for the people that we seek to serve, who by and large, come from communities that are middle income to lower income. Then, I think it's also worth noting kind of the upper end, there were two people who had $250,000 eliminated. Everyone else was below that. So we're talking about medical debt that is reasonable, that I think we all understand. When I take my kids to the emergency room, I'm not asking how much things cost, I'm looking for medical care. And we've all been in this situation where we inherit some sort of medical debt, not knowing what it's going to be on the other end. And I'm just so happy that we found a way to be able to help families be able to move forward, knowing that what the decision they made at the right time in incurring that debt was the right thing to do. We'd love to thank Undo for being a partner throughout all of this, educating Councilman Harsh, me, Council President Griffin on sort of the ins and outs and how we can leverage dollars further and how philanthropy works, as Councilman Harsh said. And as we've seen this program grow across the United States, I'm really hopeful that you've been able to use us as an example of how impactful this can be. So with that, I'd like to introduce Courtney Story, who is the Government Initiatives Lead, the Vice President with Undo. Thank you for coming.
Thank you for having me. Good morning, and thank you for having us here today to celebrate the great work that we've been doing in Cleveland. It is an honor to be here with Council President Griffin and Council Members Harsh and Slife. My name is Courtney Story, and I am the Vice President of Government Initiatives at Undo Medical Debt. I want to sincerely thank everybody for their leadership in addressing medical debt. We are proud to partner with you guys and are grateful for your commitment to our work. With your support, we have abolished over $165 million in medical debt for more than 160,000 people in Cleveland. That is really huge. Medical debt is not a debt of choice. It is a debt of necessity. No one asked to get sick. No one asked to get injured, but for too many people, a trip to the hospital turns into financial distress. Medical debt forces people to delay care, it can impact credit, and it weighs heaviest on communities who are already facing inequity. At Undo Medical Debt, our mission is simple: eliminate medical debt for those who need the relief most, so that one day we are no longer needed. We do this by leveraging government and philanthropic funds to acquire and erase medical debt, while also shining a light on the systemic challenges that create medical debt in the first place. We are now in over 25 cities, counties, and states across the country, and our work is continuing to grow. We will absolutely use Cleveland as an example of the wonderful work that can happen and how, for very little money, you can return a large investment for your residents. Our model allows us to purchase debt in bulk directly from hospitals, health systems, and the secondary market. Individuals qualify for relief if they earn up to 400% of the federal poverty level or if their medical debt exceeds 5% of their annual income. Once we acquire the debt, it is simply erased. There is no application, no red tape, no strings attached. Individuals are notified by letters in the mail that their debt was abolished, and Cleveland residents will expect to receive additional letters in the coming weeks. They started hitting mailboxes, I believe, last week, and we're very excited about that. Cleveland's investment has set an example for what local leadership can accomplish, and we are so proud to be a part of this work. Thank you again to the City of Cleveland for your leadership, and we are just very excited.
Do you guys have any questions? We'll take a few.
How does the actual mechanism of this work? And like for Cleveland, how much philanthropy or other funds do you need to use, like along with Cleveland dollars, or use any? And why stop it?
You just want to hang out up here.
Like, was there more you could have done that you kept spending?
Do you know about the secondary debt market? She'll explain.
Yeah. So there's a couple of different things. So in Cleveland, we made purchases both from hospital systems as well as the secondary market. With the secondary market, we're able to target the zip codes where the dollars we have, so we're able to say, we're only going to purchase the debt from you guys for the residents in Cleveland. Hospital systems are a little bit trickier because, as I'm sure you guys can imagine, you don't always seek care where you live. So when we purchase a file from a hospital, we may purchase accounts for residents that are not in Cleveland, but sought care at a hospital based in Cleveland. So what we will do is we will purchase that debt, and then we will fundraise privately behind it to try to abolish that debt on behalf of those residents. But we, of course, won't use Cleveland dollars because they're not residents of Cleveland.
Are you able to negotiate prices down?
We pay the same price that a secondary collector would pay, yes.
I think this is a really important part to drive home. A lot of the debt that was purchased and forgiven through this process is debt that would have otherwise been purchased by debt collectors who then hound people for this money. Those calls that never stop, you know, I need my 500, I need my 800. Not only do they hound people for this debt, but they actually increase it because they throw an interest rate on top of it because they're trying to capitalize on their purchase of your debt. So by purchasing this, not only do we just forgive the debt, but we actually save the person from the trouble of being harassed by these debt collectors.
And because we purchased from secondary collectors themselves, we're also breaking that cycle there as well. So they would no longer be reaching out trying to get folks on payment plans or to make payments or to bring them current.
I think, yeah.
So my understanding is there's been two announcements prior to this. One where Metro Health sold some of their debt, one with an unnamed medical system. Is there a third medical system that you all are announcing today that sold some of their debt through this process?
This last batch is both secondary market and a second file from Metro Health. So Metro Health provided additional files to us after the first file.
Okay.
Yep.
Okay, so secondary market means it wasn't a specific hospital system that sold
It likely came from a hospital system or possibly an ER or physician group, but it's now a private entity that holds that debt, that purchased it from the hospital or wherever it was, and now they are collecting on it. So it's the private market.
I think it works like this. Debt collectors buy debt from the hospital. They collect whatever they can. Whatever they can't, they put back out there on the market. The
Yeah.
debt doesn't go away, but it makes it into the secondary market.
Correct.
So that secondary debt is a little bit all over the place.
And then we'll see the secondary market can also pass amongst itself as well. So if they feel like they've tried everything they can on account, they could possibly sell it again to a new provider, and then that process starts all over.
So how many more people on top of what you all already announced received?
So the 161,000 people is our total number of unique individual Cleveland residents that were assisted through this program.
We can get you the numbers of each of the announcements and how many were included in each, but just know that you can't just add them all together because multiple individuals may have received relief in multiple cycles because it's per account, not per individual that we purchased at. It's very nuanced, so I apologize, and I will make sure you guys all have my card if you have questions for follow-up. We're happy to talk the specifics.
I guess, what does it say that this many Clevelanders had medical debt to be forgiven to? I mean, that's a staggering amount of the population who
I mean, I was a young parent in 2010 when Obamacare was passed. And it was a game changer for me because I didn't think I was going to be able to afford to have a second or third child at the time. The medical debt that was accrued in this country before we expanded Medicaid was astounding. It was the number one driver of bankruptcy. And there were 40 million people that were uninsured in America. All those people had medical debt. Almost no one makes it through life without having some kind of medical situation at some point. So if you were the 40 million that had no medical debt, that had no insurance, you probably had medical debt. And some of this debt is old. Not all of this debt was racked up last year. Some of this debt goes back a decade, goes back longer than that. So there's a lot of backed up debt in the hospital systems. So I'd be curious if someday we can really dive into the math to find out how modern debt accumulation is going with an expanded Medicaid, with better health care, and what that could potentially look like if we actually achieved universal health care someday. Wouldn't that be wonderful? But
Yeah.
I think that's part of the reason. I don't know if you have.
No, absolutely. I think all of that is correct. I think it just speaks to the challenges with how we finance healthcare. I think it speaks to, no one is the problem, right? The hospitals are not the problem. The patients are not the problem. It's a systemic challenge that is uniquely American, and there are lots of different ways that we can tackle it. But I think we know that folks are underinsured. And I think if you look at the data here, a lot of the folks that received relief actually did have insurance. But copays and out-of-pocket maxes and deductibles are all so high. Trying to be able to pay $13,000 to get care, that's kind of crazy for a lot of people when the median income is $54,000. So I think there's a lot to be said to how healthcare works and how folks understand their current healthcare plans.
And why stop and not use the whole $1.1 billion allocation? Is there a
Yeah.
technical reason why it's running down?
That's a great question. Ultimately, our work depends on hospitals selling us their debt files, and we kind of tapped all of the hospital relationships that we felt that we could in Cleveland, and we know that the City Council had wanted to use this funding to address some other really critical priorities in Cleveland, so we collectively made the decision that we felt we were in a very good place with the work that we have done, and we felt comfortable reprioritizing those funds for something else.
Did UH or the clinic sell any medical debt?
The only partner that we will name publicly is Metro Health. All of our hospitals have the choice when they work with us if they would like to be named publicly or not, and we really respect their privacy and that decision.
Yeah.
I currently have a $950 COVID RSV test bill from the clinic. You guys take care of that?
Yeah.
But seriously, in regards to the pay transparency legislation on Monday that passed, which is great, which is progressive, and we just voted on it last day. I'm wondering, can you guys do anything about, transparency when I go to my doctor and have the option for a voluntary test, a COVID test, or RSV test, et cetera? Can we do something at City Council to increase that transparency to where I know what I'm going to pay from my perspective before I have insurance, without insurance? Is there anything we can do? Because that's, if I voluntarily don't need a specific test from the clinic, knowing it's $1,000, knowing that my insurance is only going to cover it.
I will admit I don't know.
Do you want the lawyer to talk
So
about
if somebody
preemption?
wants to, you want to have a
Yeah,
whack at it?
Sure. My name is Councilwoman Rebecca Moore. In a former life, I was a consumer law attorney, so worked at different times with attorneys from the Consumer Financial Protection Bureau. I actually wrote a chapter of the Ohio Consumer Law textbook, which is literally this thick on student loan law. And part of what you're getting to is something consumer advocates have wanted for so long, which is that you know what it's going to cost when you walk into a hospital. You know what it's going to cost when you go buy a used car. And essentially, because of the way our system works, state and federal laws have to govern that, and there's very little that the city is allowed to do on top of that. It's called preemption. But if any consumer law attorneys want to think it through with me about what we can do to make sure that you don't get sticker shock when you go in for a test, there's even some fascinating stuff about sort of going to a hospital that's in network, but then your doctor who provides service to you is out of network, and then you get billed for that. And how are you supposed to know? Were you supposed to call the insurance company while you're in a medical emergency and figure out what's going on? That has to be regulated at the federal level. Yeah, exactly. Thank you.
Yeah. I've already been asked this week to change the state budget process, so I'm going to say that the state issues.
What are you doing here?
Yeah, right. One thing at a time. Yeah.
Can any of you speak to any anecdotes or folks you've spoken with on the street who have had
Yeah, I've had a number of people come up to me. I'm glad you asked. A number of people come up to me and told me that they received the letters. One lady was a teacher, and she said, I got this letter. It was a $250 bill. I forgot I even had it, but I'm glad to know that it's gone, right? And I think that was probably a common experience for a lot of people. There is a Facebook page for my neighborhood, living in Old Brooklyn, or one of those, where people were all piling on one day and said, did you get a letter? I got a letter. Did you get a letter? Is this real? Is this actually happening? And I got in there to reassure them that it was. But a lot of people were getting these letters. Some people sometimes forget about their debt. And this is how that sort of piles up in the back of your head, right? It's just one of those things you owe. You've got a problem, but you have to kind of push it back because you can't stare at it every single day. And you don't have the money for it, so it's not going to do you any good to fret over it. So for a lot of people, getting that letter was like, oh, cool, I don't have this debt anymore. I can mentally check that one off my list of things that I'm trying to keep track of. So I really appreciated hearing from the folks that they got the letters, and some of them had forgotten about the debt, but were glad to know that it's gone. I don't know if any of you have.
We do collect constituent testimony, and I would say if you do get a letter, there's a QR code on it where you can share your story, and we encourage everybody to do that. Medical debt is very stigmatized in this country, and we want to make sure that folks have the opportunity to share their story and have their voices heard and destigmatize this issue, because everybody knows somebody who is affected by medical debt if it wasn't yourself or your family.
I'm sure there were only so many people you could help, only a certain amount of money. I mean, what's the message to people maybe who weren't able to be helped? Could there be other programs down the line? Could something like this happen again or something like that?
Yeah, I mean, I think we did everything we could with this round of work. Maybe we come back to this in 5 to 10 years and we revisit it. I expect that undue debt will be around. I know you would like to put yourselves out of business, but
Hopefully we're not, but
this
I
is still
certainly will
America,
be.
and we'll probably still have this problem. So maybe we can revisit at a later date. I have looked into, and just sort of on the surface level, other forms of common debt. But other forms of common debt really get into consumer debt. You end up like car loans and mortgages, and I think there's already a slate of books of laws about that. So maybe we could revisit this again someday, but I think that this was the most we could do in this round and the most we could accomplish now.
And I do think that is a really important message, though, to residents of Cleveland. Don't put your medical debt on a credit card, because then it does not stay medical debt, it becomes consumer debt, and you lose a lot
Great
of
point.
protection. So just please keep that in mind.
Okay.
Council do the last $1 million.
We will have an internal discussion about that and do something very good for people. We're going to cover his 900. No, we're not. All right. Okay. Thank you for coming, everybody. Appreciate you being here.